Listen to the timing of the itching. If itching peaks at night, we have two major causes. First, bowel parasites. They could be in play because they migrate through the anus in the perineum at night to deposit the eggs. They are more frequent in children and adolescents, with rare cases in adult and elderly women, but the search of parasites is key in the fishes to confirm the diagnosis. The search of the parasites in the fishes will confirm the diagnosis. Clinical examination, a vaginal swab with exam of the secretion at the microscope in the office, or a culture test can confirm the diagnosis. The most frequent etiology of itching at night with increasing age is the so-called vulvar lichen sclerosus. It is present also in children and adolescents, but it increases in prevalence with increasing age. It is an autoimmune disease. What does it mean? That our army, the immunitary system, attacks the vulvar tissues in all their components with progressive thinning and whitening of the vulvar skin, fusion of the labia, destruction of the tissue, and damage to the nerve terminals, the nerve endings, and this is responsible for the itching feelings. A very careful examination is key, even with a biopsy if indicated, and then appropriate treatment with cortisol, testosterone is key. When the itching is also frequent during the day, think about the Candida infection and, important, to an aberrant response of our immunitary system, abnormal response, to the Candida antigens, because this causes itching, and again, we need clinical examination of vaginal swab with the exam of the secretion at the microscope of the office and a culture that can confirm if really a Candida infection is in play in causing this itching day and also at the night. The predisposing factor include first inappropriate diet rich of sugar. That's why we strongly recommend a sugar-free or almost free diet. Why that? Because sugar gives a lot of energy to the Candida and she will aggress us with much more intensity. But also because sugar causes gut, vaginal, and vulvar dysbiosis. Second, we may have hyperactivity of the pelvic floor, too tight on the pelvic floor, and this predisposes to microabrasion that increase the probability of the aberrant immune reaction to Candida antigen. And then vulvar and vaginal dysbiosis that worsen the infection and predispose to recurrences in spite, very important, of to oral and topical antimycotic treatment. Lifestyles with appropriate diet and daily aerobic outdoor activity, such as brisk walking outdoor in the morning, also to go to work, can optimize the circadian biorhythms, may optimize the glycemic control, and reduce the shift from spora to IFA, the active form of Candida infection. Normalization of the pelvic floor muscles tonus with appropriate hands-on physiotherapy is key to reduce the biomechanical contributor of vulvar and vestibular microabrasions, the tiny cutting, like women say, which amplifies the Candida symptoms through an aberrant immune response in predisposed subjects. Probiotics may help in synergy with antimycotics.